Well, we're back and we're going to continue our discussion on coding diseases of the cardiovascular system, starting with heart attacks. Again, as we talked about, we have specific guidelines for intraoperative and post-procedural cerebral vascular accidents, otherwise known as stroke, sequela of cerebral vascular diseases, and others. Please read these guidelines very carefully, especially the ones dealing with the last bullet point, codes from the I-69 code category and Z86.73 codes. Now we get into myocardial infarctions again. And again, we get into type 1 heart attacks. Type 1 is when there's a sudden blockage due to plaque rupture and a resulting clot. Type 1 myocardial infarctions are signed to codes I-21.0 through I-21.4. Type 2 heart attacks, on the other hand, use I-21.A1, and you must code the cause first. We don't code this as I-24.8. If a type 2 AMI, or heart attack, if you will, is dependent on the circumstances of the admission. When a type 2 AMI is described as a STEMI or non-STEMI, only assign the code I-21.A1. Codes I-21.01 through I-21.4 should only be assigned for codes for type 1 AMIs, excuse me. And again, they're very specific guidelines for type 1 STEMIs. These can be described as type 1 STEMI and non-STEMI, acute myocardial and cardial infarctions, unspecified, AMIs documented as non-transmural or subendocardial, but site specified, subsequent acute myocardial infarctions, and other types of myocardial infarctions. And again, use these extra codes to show any tobacco use or which side of the heart the vessels are on. The codes get very specific in terms of the laterality of the vessels. And now we get into rheumatic heart fever. Acute rheumatic heart fever happens after a strep throat and it can hurt the heart. And again, you see these things mentioned as rheumatic chorea, some of these other things, right? So we have to read the documentation very, very carefully to get at what exactly we're going to be coding. Chronic rheumatic heart disease happens after rheumatic fever and can damage the heart valves. Chronic rheumatic heart disease, when you code this, you're coding diseases of the mitral valve and diseases of both the mitral and the aortic valve. So you have to follow the index to the diseases very, very carefully. When a physician describes the disease of the mitral, aortic, tricuspid, and pulmonary valves as non-rheumatic, these conditions are classified to categories I-34 through I-37. And again, there are very special rules on coding different types of hypertension, like whether it's secondary pulmonary hypertension, hypertension uncontrolled, controlled hypertensive crisis, and so on. Bottom line is, when we talk about hypertension, we're talking about high blood pressure. And to find these codes, we'd look in the index under the main terms of hypertension and hypertensive. The code for The most common type of hypertension, essential hypertension, is I-10. And blood pressure readings may be described as normal, prehypertensive, stage 1, stage 2, and so on. Secondary hypertension is normally due to renal disease. With hypertensive disease, we can have complications. These include left ventricular failure, arteriosclerotic heart disease, retinal hemorrhages, cerebral vascular insufficiency, and renal failure. Benign hypertension remains stable when treated. A term you see sometimes is malignant hypertension. This is a less common disease with an abrupt onset, resulting in vascular damage to the kidneys and a life-threatening situation. Hypertensive heart disease is I-11. Hypertensive heart disease is the result of secondary effects on the heart by prolonged systematic hypertension. This results in thickening of the left ventricle and ultimately produces heart failure. When the patient has heart failure due to hypertension, two codes are required. We have a code for I-11 for the hypertensive heart disease and a code for I-50 code category for the heart failure. In this case, we definitely would not code the I-10. It's understood that the hypertensive heart disease includes the hypertension by its definition. And again, more on hypertensive heart disease, the I-11. ICD-10-CM presumes a causal relationship between the hypertension and the heart involvement. So these two conditions are linked by the term with unless otherwise specified by the physician. These conditions should be coded as related even in the absence of explicit provider documentation that links them. If a patient has both heart disease and kidney disease from hypertension, code both and show the stage of the kidney disease and the type of heart failure. We can have chronic kidney disease due to hypertension. And once again, ICD-10-CM presumes cause and effect relationship. The physician does not have to state the connection. Chronic kidney disease should not be coded as hypertension if the provider indicates that the chronic kidney disease or the CKD is not related to the hypertension. Hypertensive chronic kidney disease falls into code category I-12. In this case, again, as you'd expect, an additional code from category N18 chronic kidney disease should be used with the I-12 code to identify the stage of chronic kidney disease. Separate codes exist for hypertension with different stages of chronic kidney disease. If a patient has hypertensive chronic kidney disease and acute renal failure, the acute renal failure should also be coded. You would sequence them according to the circumstances of the admission and the encounter. In other words, what was the principal reason after study that the patient was admitted, or what was the reason for the encounter? And that's all I have for you. Come back for our next lecture where we'll talk more about coding diseases of the cardiovascular system. Bye now.